In the last class, we talked about the generalized periodontal patient. That's where we see a lot of blood and a lot of calculus. And truthfully, we as hygienists tell ourselves this is going to be a lot of work. And so it's really easier to treatment plan and present treatment to that type of patient. I have found that in many practices, the localized perio patient is the most misdiagnosed and the patient that most often gets a prophy when they need something more. This is often the reason practices perio percentage is low, like 4% of hygiene production. And when 80% of American adults have some sort of gingival infection, that just doesn't make sense. You guys know what this patient looks like. They have pink stippled gingiva in the smile zone, but they have bloody inflamed tissue around their molars. It might just be 1 or 2 quadrants, or it might be around all 4 of them. They probably have moderate calculus on the maxillary posterior teeth buccal surface and mandibular anterior lingual surface. The calculus load would not be a problem, but there is active inflammation and bleeding going on. So the first appointment with the localized perio patient goes exactly the same as with the general perio patient. Present the case by probing out loud, tell them what it means, sit them up, tell them the bad news is they have some gingival infection that has gotten into the bone, and the good news is that they are here now and together you can treat it successfully. Have them watch the video on periodontal disease, classify the patient, sit eye to eye and knee to knee and tell them that you need to do 3 things differently. We need to do a different kind of cleaning to reach more areas in more than one appointment. We need to change what you're doing at home because what you're doing isn't working, and then we need to see them more often. Give them the pamphlet and do the tip of the iceberg 1110P IPT initial periodontal treatment therapy appointment after the exam, and them off to the treatment coordinator for financial arrangements. The second appointment would be the active periodontal therapy or APT, coded 4342, 2 to 4 times. If the patient has only 1 quad of 4342, you actually might be able to do it at the initial appointment and code both the 4342 and the 1110 at the same time. But that usually means your case presentation went really fast or your next patient canceled and you can go on for 90 minutes. Charles Blair says, in coding with confidence, that this would not be an inappropriate thing to do, but give a narrative of the time spent. If you can't do 1 quad 4342 on the same day as a prophy, schedule a second appointment. I hope you could get 1 to 3 teeth done in 30 minutes. But if there's more than 1 localized quad, schedule 30 minutes to an hour if needed. Remember, there is no exam or x-rays to be done. There's fewer teeth to root plane. And you have a 90% chance of not needing any anesthesia. If you think they will need anesthesia, make the appointment 90 minutes instead of 60. But don't make it 2 appointments. Watch your productivity here. The last SPT, supportive periodontal therapy appointment, is the same as the generalized perio patient appointment. It is coded 4910 4 weeks later, where you reprobe, scale, break, place a Reston or use a laser if needed, polish, floss, and do fluoride treatment. Then reschedule for a 3 to 4 month recall with the goal of getting the patient back to a 6-month recall and a preventative 1110 appointment. Remember, code what you do and charge for what you do. When you explain the financial obligation to the patient, boy, getting back to that 1110 100% covered appointment of a prophy is a really good motivator for them to increase their home care. Now, let's talk about the gingivitis patient. You know the guy. No clinical attachment loss, but red, inflamed gums that bleed. I proceeded 2 different ways with this patient. And it depends on really the workload. How much gunk do I have to deal with? Let's address the patient that is bleeding, inflamed, but doesn't have a lot of buildup. First and foremost, make sure it is not medication induced or systemic condition. Let's assume it's not. They just have some buildup around the gum line and really they just need to do better at their home care. This is the patient I would code an 1110G, G for gingivitis. I would spend extra time on home care, make sure they use a power brush correctly, and get them on a good home rinse. And then tell them what happens if they don't clear this up. Explain to them that this will progress to the bone and the mouth-body connection. Again, this is the patient that you tell them if they don't get this under control with their home care, they're gonna have to start paying out of pocket for their cleanings. This is the patient that really really, they need you about this much, and they need to use their power brush and mouthwash this much, and they would get better, okay? So it's an 1110G. I will let them know that I'm putting them on a Perio alert and making a notation in their file. I'm putting that in their file because they are at risk, and I want to check back with them. Often this is just what the patient needs to increase their home care, and I don't need to do anything more or charge them any more than 1110. Then there's the second type of patient though, and this patient has generalized inflammation and generalized bleeding, no clinical attachment loss, but a ton of buildup to remove that will take a lot of time and energy. They most likely have been on Perio alert before and home care hasn't improved. I code this appointment as 4346, then see them in a month for an 1110G. I do this for two reasons. I need 2 appointments to get all the gunk off, and the patient will take ownership as they will know they're sick and they have some skin in the game because there's an out-of-pocket expense and it's gonna cost them financially now. I have a free downloadable blank form where I made up different types of patients with different periodontal conditions. They're fake patients and they're named after superheroes. Have each member of your team fill it out with a treatment plan they think is correct. I also have a form with my answers on it. See how you do. I also have a flow chart so that you can follow appointments for a healthy patient, a gingivitis patient, and a perio patient. So you have something to refer to when treatment planning. Now let's look at the profitability of these appointments. Once you've done those two exercises, you look at the fake patients that I've come up with, you try and treatment plan them, compare them against the answers, review the flow chart, make sure you have a good idea of what to do, review these last two videos if needed, then look at my spreadsheet with the examples of different appointments and how much they might cost, and go through them with your fees. Fill in that blank spreadsheet with your fees and you will see your productivity per hour and how it's different with full mouth disinfection, doing 2 quads at a time. One of the most profitable appointments can be an 1110 with a 4342. And again, if it's a localized perio patient, do an 1110, reschedule, do a 4342 in a half hour or 2 in an hour. But make sure you watch your profitability. That's it, guys. Hope this is helpful and let me know if you have any questions.